Lymphoma or lymphatic cancer severely affects the body's ability to fight germs. And while it's pretty rare in humans, it's the most common form of cancer in dogs. In fact, more than half of our furry friends older than 10 will develop some type of cancer. And since today is National Canine Lymphoma Awareness Day, we want to bring in Dr. Susan Mendez from BluePearl in Jacksonville. Good morning, doctor.
Good morning.
Well, thank you so much for joining us. So my first question is, what is canine lymphoma?
So this is a cancer of a type of white blood cell called a lymphocyte. It typically affects the lymph nodes, but we can also see it in the liver and the spleen and other organs in the body. And usually the way we find it is because patients will have enlarged lymph nodes that the owners can feel.
Wow, and besides enlarged lymph nodes, what are some of the other symptoms?
Other symptoms can be nausea, lethargy, decreased appetite, and sometimes diarrhea as well. Those are probably the most common.
And what treatment options are available?
So the treatment of choice, because this is a whole body cancer, is whole body treatment with chemotherapy. And there's a variety of options as far as chemotherapy protocols. But the one that is most effective is a weekly to every other week injectable chemotherapy protocol. And with that, we have an average survival time for most dogs of about a year compared to just 1 month if you don't get any treatment.
And we know dogs older than the age of 10 have about a 50% chance of developing cancer. So let's say your dog who's 10 or 11 years old does get this cancer. About how long would they have to live if they decided to do chemo or no chemo?
Yeah, so if we do the kind of standard of care chemotherapy, which is a weekly protocol called CHOP, the average survival time for most dogs is about a year. And there's a variety of other chemotherapy options available if that's something that you can't do or you're not interested in doing. There's some oral chemotherapy options that are require less visits to the hospital, and that just depends as far as survival time, which option you choose. But we know that if we don't treat, the survival time is quite short, and we usually lose patients in about a month.
And we know chemo can have some side effects. How could chemotherapy affect some of the dogs receiving treatment?
Yeah, and that's a big concern for a lot of owners. I will say that in veterinary oncology, our goal is a little bit different. We definitely want to extend life, but not at the expense of quality of life. So, having said that, we do see some side effects in about 20 to 25% of dogs. The most common are gastrointestinal, like decrease in appetite, nausea, vomiting, diarrhea. Those tend to be pretty mild and are easy to manage at home with medications. Less than 5% of our patients are hospitalized for chemotherapy side effects. And if your dog does experience side effects, then we'll probably change the dose or the drug so that that doesn't happen again, because our goal is that they have a normal quality of life throughout treatment.
All right, that is a lot of important information that I know is going to help so many dog owners who honestly might have no idea about this type of cancer. So thank you so much, Dr. Susan Mendez, for joining us.
You're welcome. Have a great day.
You too.